I am Peggy Hartshorn, president of Heartbeat International, one of the pregnancy help networks featured in the report. I'm happy to highlight two areas of service of our pregnancy help movement. The first area is our urban initiatives. Pregnancy centers have historically grown up in the communities where their founders lived, often in suburbs, small towns, and rural communities, where neighbors understood the needs of women and girls with unplanned pregnancies and had the time and resources to organize nonprofit support ministries. It became evident that most abortions were occurring in our major cities, but most pregnancy center services were not located there. This report notes that only 13% of the counties in the United States actually has an abortion facility. But 65% of all U.S. women live in these counties. Abortion networks have put the vast majority of their businesses in metropolitan areas, with many of them in predominantly minority neighborhoods. In fact, this results in a disparate impact of abortion on minority groups. 59% of all abortions are performed on African American and Hispanic women, who comprise only about 24% of all women in the United States. Both CareNet and Heartbeat International embarked on a separate but coordinated urban initiatives in 2005 to steer our movement into the areas of greatest need. Many pregnancy help centers have now opened in the heart of major American cities, the result of existing centers relocating or opening additional offices in these areas, or as a result of proactive new center planting. These new centers are often the outreach of a particular church or group of churches and organizations partnering together in the inner city. And they are led and supported primarily by the African American and Hispanic communities. This report features, for example, Heartbeat of Miami, founded in 2007 with offices in Hialeah and North Dade. These are pregnancy help medical clinics. Where there were once over 36 abortion clinics and no pregnancy help medical clinics, now there are these 2 clinics to provide life-affirming choices and plans for additional clinics on the way. Originally prompted by Heartbeat International's urban initiative and leaders like Dr. Alveda King, who is a Heartbeat International board member and niece of Dr. Martin Luther King Jr., local congregations and parishes, Protestant, Catholic, and non-denominational, now provide the leaders, support, and volunteers that serve thousands of clients yearly in some of the neediest neighborhoods of Miami. My second area of focus today is our international network. The growth of alternatives to abortion services begun in Canada and the United States in the late 1960s, hence our 40th anniversary coming up, inspired the founding of help centers scattered overseas in the 1970s and 1980s, especially in the Western world. However, in the last 2 decades, life-affirming centers have been established on nearly every continent. As far as I know, not in Antarctica yet. As noted in this report, Heartbeat International has published a worldwide directory of life-affirming pregnancy service providers since our founding in 1971. Recent additions of our directory include approximately 3,700 entries in the United States, but another 1,700 entries around the world. The ratio of abortions to live births is even higher in many countries overseas than it is in the United States, and often maternal and child health support, ensuring healthy pregnancies and healthy babies, are difficult to obtain. So, pregnancy centers provide a tremendous health service benefit in their communities overseas as they do in the United States. Those called into this work often look to the United States for help, and we both respond to these requests and also, as in our urban initiatives, we have proactive programs that plant centers in the areas of greatest need overseas. CareNet has extended its services to 64 centers in Canada. Life International, founded in 2001, has the mission to multiply healthy, life-giving ministries wherever abortion exists in the more than 180 nations around the world. Heartbeat International has nearly 250 affiliated pregnancy help organizations in nearly 50 countries. We provide resources and consultation, plus training on site, in conferences overseas, and through scholarships to Heartbeat International training in the United States. So truly, our pregnancy help networks are ministries on the move.